Have you noticed someone you love starting to change, slowly, almost unnoticeably, over the past year? Maybe they've lost weight without trying, seem more tired than usual, or act a little distant. Most people think that death in old age comes suddenly. One day you're fine, and the next it just happens. But the truth is, the body often whispers its warnings months, sometimes even a year before life reaches its final chapter. The problem is, those whispers are so gentle that families rarely hear them until it's too late, when they look back and realize the signs were there all along. In this video, we'll talk about 5 quiet but powerful signs that often appear during the final year of life. Some may look like ordinary aging, others might seem small at first, but they're actually messages from the body that deeper changes are happening inside. By recognizing them early, you can offer better care, create meaningful memories, and, most importantly, make sure your loved one's final stage is filled with comfort, dignity, and peace. So stay with me until the end, because understanding these signs can help you prepare emotionally and practically for what's ahead. Let's begin. 1. Noticeable and unintentional weight loss. One of the earliest and clearest signals that the body may be approaching its final year is weight loss without trying. It might start subtly. A belt suddenly needs tightening, clothes fit a little looser, or their appetite just isn't what it used to be. Many families assume it's simply old age, but in reality, losing weight unintentionally is rarely a good sign. It often means the body is no longer absorbing nutrients as efficiently. Muscle mass begins to shrink, and major systems start to slow down. Natural aging does cause some muscle loss, but when it happens quickly, it usually points to something deeper. Sometimes the body struggles to process protein or digest food properly, which leads to muscle wasting and weakness. This not only makes movement harder, it also weakens the immune system and increases the risk of infections or falls. In many older adults, appetite changes too. Food may no longer taste the same. The sense of smell fades. Eating becomes a task instead of a pleasure. This isn't just preference. It's the body signaling that it no longer needs or wants as much fuel. Energy starts being conserved, not replenished. Underlying conditions, like heart failure, kidney disease, or cancer, can quietly drive this change long before stronger symptoms appear. Even depression or cognitive decline can reduce appetite and create a downward spiral. Families often respond by encouraging them to eat more, offering favorite dishes or protein shakes, but when the body is entering this stage, forcing food rarely helps. Instead, focus on comfort, light meals, hydration, and foods that are easy to enjoy. If your loved one is losing weight even though they're eating normally, it's time to pay attention. Because this isn't about looks. It's the body's way of saying something deeper is changing. 2. Deep, persistent fatigue and weakness. The second major sign is a kind of exhaustion that sleep can't fix. This isn't the normal "I'm tired" feeling after a busy day. It's a deep, whole-body fatigue that makes even simple tasks, getting dressed, walking across the room, holding a conversation, feel heavy. What's happening inside is that the body begins to conserve its remaining energy. The heart pumps less efficiently, circulation slows, and muscles receive less oxygen. So rather than spending energy on movement or activity, the body shifts toward preservation, resting more and doing less. You might notice longer naps during the day, shorter periods of alertness, or a need to sit down frequently. Sometimes energy levels can swing. One day they seem okay, the next they're completely drained. Emotionally, this can be painful. Many older adults who've been independent all their lives start feeling frustrated or even embarrassed by their weakness. They might withdraw from social activities, not because they don't care, but because they're just too tired. This can create a cycle of isolation that speeds up decline. For families, it's important not to mistake this for laziness or lack of motivation. What they truly need now is understanding, permission to rest, and a peaceful environment that honors where they are in life's journey. If your loved one is sleeping more, moving less, and seems constantly drained, it's likely their body is preparing for a major transition. Your compassion, patience, and presence mean more than any activity you could plan. 3. Increasing confusion or emotional withdrawal. Another powerful sign often appears in the mind. You may notice someone who used to be sharp, funny, and engaged suddenly becomes forgetful, repeats themselves, or loses track of time. They might seem disoriented even in familiar places. This isn't simple forgetfulness. It's often a result of reduced oxygen and blood flow to the brain. As circulation weakens, the brain can't function the way it used to. Decisions become harder and focus slips away. Some people even experience moments of clarity, short bursts of lucidity, followed by sudden confusion. You may also see emotional withdrawal. They talk less, seem detached, or prefer sitting quietly rather than engaging. It's not that they've stopped caring, it's that their brain no longer processes emotions and conversation in the same way. Mood changes are also common. Some become irritable or anxious, while others seem unusually calm or detached. These are not personality changes. They're physical signs that the mind is adjusting as the body slows down. For loved ones, this can feel heartbreaking, as if you're losing them before they're truly gone. But it's crucial to remember, they can still feel your presence and love, even if they can't always express it. Speak softly, hold their hand, and meet them where they are. You don't need to pull them back. You just need to be with them. 4. Frequent infections and slow healing. As the body weakens, its immune system becomes less capable of fighting off illness. You might notice that colds, urinary infections, or skin wounds happen more often and take much longer to heal. A small cut that once healed in a few days may now linger for weeks. This isn't random. It's a sign the body is struggling to repair itself. Blood flow slows, oxygen delivery decreases, and tissues can't regenerate as quickly. Common infections like pneumonia or urinary tract infections can become recurring problems. Sometimes they no longer respond well to antibiotics that used to work easily. Even mild infections may trigger sudden confusion or fatigue, often before any fever or pain shows up. That's why families should watch for subtle changes, not just obvious symptoms. At a certain point, care often shifts from curing to comforting. Instead of endless hospital visits, the focus becomes making sure they're hydrated, their skin stays clean, and their days are as peaceful as possible. Aggressive treatment may not always bring healing, but comfort and dignity always bring peace. 5. Changes in breathing and circulation. One of the most visible signs that the body is nearing its final stage is a change in breathing and blood flow. You might notice breathing becoming shallow or uneven, sometimes slow, then suddenly fast, followed by long pauses. This rhythm is known as Cheney-Stokes breathing and often appears in the last months or weeks of life. Hands, feet, or even the nose and ears may start to feel cold, and the skin can look pale or slightly bluish. That happens because blood is being redirected to the vital organs, the body's way of preserving what truly matters. Even small movements, like changing position or talking, may cause shortness of breath. Some people prefer sleeping propped up or in a chair to make breathing easier. For family members, this stage can feel frightening, but these changes are usually a natural part of the body's slowing rhythm. You can help by keeping the room cool, using a humidifier, and offering small sips of water. At this point, medical focus isn't on fixing the symptoms, but on comfort, calm, and presence. Your voice, your touch, your reassurance. Those are the most powerful medicines left. As we close, take a moment to reflect on these 5 signs. Significant weight loss, deep, persistent fatigue, cognitive or emotional withdrawal, frequent infections, and major changes in breathing or circulation. They don't always appear in the same order or intensity, but together they often mean the body is preparing for its final transition. It's natural to want to fight these changes, to encourage more eating, more movement, more effort. But sometimes the most loving thing we can do is simply listen to what the body is saying. Death is not always the enemy. It's part of the same natural rhythm that began with birth. And when we understand these signs, we can meet that rhythm with peace instead of fear. So if someone you love is showing these quiet signals, take the time now to talk, to forgive, to share stories, to hold hands a little longer. Because when the end comes, what matters most is not how long they lived, but how deeply they were loved.